歡迎大家出席今日。
Welcome to today's briefing. We have with us Dr. Chong Sok Kwan, Head of Communicable Disease Branch, CHP, and Dr. Lau Ka Hin, Chief Manager, HAA. Dr. Chong, please. Last night, we have confirmed 115 positive cases, 13796 through to 13910, 2 imported cases, 11 locally acquired cases, 105 are epidemiologically linked with other cases, 6 are untraceable. As of now, there are 80 or so preliminary positive cases. In Kwai Chung Estate, we have identified another case from Yat Kwai House, taking the number to 113, or 263 people involved. Yin Kwai Ha Kwai houses, we don't have any new positive cases. Chin Kwai House, we picked up another unit that is affected. There are 2 units involving 3 people. In Kwai Chung Estate, there are 396 cases, including the preliminary positive and confirmed cases. 206 units are affected. For the cases without no known source of infection, for the 6 cases, they include 138-year-old male living in Wyatt House in Soi Wai. He's working at a catering work. Last day at work, 25th of January. There is no known source of infection. Another one, 39-year-old male, a delivery worker working for Lao Song group. Last day at work at 25th of January. He lives in Tai Wo Estate, Tai Wo House in Tai Po. We cannot link this with any other case. Another one, 70-year-old female, a retiree. She lives in Chi Ching Estate, Ching Tai House. Again, we cannot trace any particular sources. She's been to Choi Wan shopping mall or thereabout. She's a Delta or suspected Delta sufferer. We will be paying particular attention to the exposure history to establish any links. Also, a 65-year-old retiree. He lives in Kwai Fong Estate, Kwai Yan House. Again, no link, no exposure history can be identified. He played badminton with a couple of friends at Zhong Kwai Chung, and a 45-year-old male living in Tai Wo Hao Estate, Fu Ping House. He's a clerical worker in Tai Wo Hao Estate. He frequents the area there. The last one that I'd like to mention is a 10-year-old girl in Lutheran school. She stopped going to school since the 11th. She lives in Tai Pa Street, Tai Yun House. She's living with her relative at Bellagio at Samjiang, and the family members would go shopping in Tai Wo Hao. From our investigation, one of the cases, together with another case, they have been to the Lion's Rise, and they go yum cha there from time to time. There are 2 more cases. There's been a yum cha there in the morning. On the 19th, they were there together, and I went there on the 21st. And we are probing the situation to identify any possible links, and maybe it's got something to do with the ventilation. One was seated at table 57, the other 20, so we will conduct a site visit there. There are some, there is outbreak in the school. One of them is the HKTA, Yun Yun Institute No. 3 Secondary School. The Ha Kwai House students went there for school, and he's in 5C, some Secondary 1 or 3B, Class 3B. There are 4 confirmed cases, 1 preliminary positive case, and there are some fellow classmates that have to be ordered into quarantine. Victory Avenue, just to bring you up to date there, we talked about 9 cases. Some are in the quarantine center, and there are 14 there in that cluster, and there are some close contacts that have been confirmed positive. Also, another Li Yin-yo secondary school, 5C and 6C students suffered from COVID. There are some students from Yat Kwai House, and there is a bit of transmission there at that school. That's it for my report for today. Dr. Lau, please. As of 9 a.m. this morning, over the past 24 hours, we have registered 150 cases, and 23 people have recovered and been discharged. There are 12,710 patients that have recovered altogether and been discharged, and there are eight patients who are in the North Lantau Hospital Infection Control Center, HA Infectious Disease Center, and AWE Community Treatment Facility, and 12 public hospitals. All of the patients in hospitals are in stable condition. And I'll throw the floor open for questions. Please raise your hand and identify your organization before you put questions. The one last but one row, the lady over there. Commercial radio. For the 2 schools, Yun Yun Institute No. 3 Secondary School, how did the transmission take place? And also for the Lutheran School, how did the transmission take place? Now, Tin Kwai House, you said you managed to identify more cases from other means. What means did you use? How to assess the points of transmission? There are some experts that said there are multiple chains of transmission in the community. How do you see the latest state of play with the COVID?
There are students who live in both Ha Kwai House and Yat Kwai House, and some are in the same class, and some sit quite close to each other, others not. But then there are some transmissions in the 2 schools. Therefore, we do have to send some of the close contacts to quarantine. Well, I talked about other methods, which means that we didn't identify them through lockdown. They actually visited doctors or clinics and was found confirmed. There are now still 6 untraceable cases today, so altogether a total of around 30 to 40 untraceable cases. That means there is silent transmission in the community. Yesterday and today, we see many retirees who have not been to too many places, and we followed and traced their whereabouts. So it means that there is some silent transmission. We just need to see if we can cut off all the silent transmission. Next question, the lady in the middle. Good afternoon from Now TV. For the 70-year-old retiree who lives in Qijing Estate, he has been to Choi Wan Mall. Would that actually lead to transmission in the mall? Would there actually be environmental contamination? Would you need to close down the mall for disinfection? And in relation to the schools, would the Yun Yun Secondary School actually be a case of origin, because there are so many students being infected over there, and they actually involve students of different grade levels? perhaps the students have been infected in the community elsewhere. Have you thought about the line of transmission? Do you have a breakdown of the Kwai Chung estate of how many cases there are in each house in Kwai Chung estate? The person who has visited the Choi Won Mall, he carries the L452R strain. We don't think that is actually the origin for infection, but we are going to follow up and try to trace it. And we will be able to identify if there are other cases. There is some transmission within the same class, and a person who is part of the PTA has also been infected. So that person is in charge of counseling the students without a set classroom. So there may be transmission over there, but that person does not remember which student he or she has been in contact with. As of 2 p.m. today, in Yat Kwai House, 263 cases involving 133 units. No new cases in Ying Kwai House. Still 87 cases, but there have been some new family members being infected involving 47 units. Nga Kwai House, 10 people, 7 units. Ha Kwai House, 15 people, 5 units. So there are no new increases in these couple of houses. For Chin Kwai House, it's 2 units involving 3 cases. Yo Kwai House, 3 persons, 3 units. Hill Kwai House, 4 persons involving 2 units. Choi Kwai House, 2 cases, 2 units. Lok Kwai House is 1 unit, 1 person. Big Kwai House is 1 case. Chon Kwai House is 5 cases involving 4 units. And Bak Kwai House is 1 case, and Chao Kwai House is 1. So altogether it's 396 cases involving 290 units. Next question. From Hong Kong 01. A question about the schools. For the CNEC Lee Yao Memorial Secondary School, I'd like to know which class the case was in. I know that for secondary school, Form 6 students, they're still able to attend schools. So were classes suspended when he was infected? In Kwai Chung, there are 2 schools that have seen students infected. Do you think that there will be further outbreak in schools? Second question on the untraceable case of the 38-year-old man. He works in a catering company. So what is his job nature? Would he be directly involved in the preparing of the food, and that would have been delivered elsewhere? And for Ha Mun Ting, do you have any case number to tell us? Would it be a contamination in the toilets? For the catering staff, we need to look into what his job nature is. We do not know yet. For the Lee Yao Memorial Secondary School, it's 5C, 5B, and 6C students. And many of them are friends from different classes. Ha Mun. For Hakka Cuisine, it's case 13464 and 13910. Sorry, it's 13526 and 13527, but now it's 13464 and 13910 who have all visited Hakka Cuisine. We'll need to look into the environmental samples. Next question. The gentleman in the back. from TVB. For the 6 untraceable cases, were they infected with Delta or Omicron variant? The 65-year-old untraceable case, was that a male or female? And for the Songshan Mall, does the CHP believe that there should be a compulsory testing notice issued so that all those who have visited the mall should be tested? The 65-year-old is a female living in Tong Yen Court. For those 6 cases, 5 of them are suspected carrying the Omicron variant and 1 carrying the Delta variant. And that is the one who lives in Tsi Sing Chun, who has visited Choi Won Mall. For Lions Rise, we are going to issue a notice. Good afternoon from Ming Pao. I'd like to ask a question about the overall pandemic. So there are many different lines of transmission. Some experts believe that the lockdown policy is only semi-effective. When would you move on to a mitigation strategy? I see that many untraceable cases seem to have the onset on January 22nd and 23rd. So why were the cases confirmed so late? Was it because they did not seek medical help? For case number 13759, the onset was on January 22nd. So I would like to ask why that case was confirmed so late. And is that also involved in the Fu Ping court case? And how do you look at Dai Wo Hao? Do you think that the how do you look at that case? And for the environmental sample in some of the sewage, were they Delta or Omicron variants? And for the Sin Kwong Center, how long do you think they would be restricted? I don't have details on 13759 because it is not today's case. It's actually yesterday's case, and I don't have the details with me right now. We try to follow up on their records, and some tell us that they have not been feeling well earlier on. Some visited the doctor, some did not. In Changpo House, we see that all of the cases are carrying the Delta variant. There are about 10 odd cases confirmed today. About 10 odd cases from Changpo House, all carrying or all suspected to be carrying the Delta variant. We have already sent high-risk residents away from the estate, and there are some that still need to be tested. We did not identify any new cases from our testing yesterday.
At the moment, we're still adopting this containment policy. Of course, containment policy alone is not sufficient. We need to have social distancing and cooperation of the public. We haven't seen any spikes. Of course, there are risks involved because of these untraceable cases. If we have any super spreading events, we may see exponential growth. But at the present moment, it's pretty stable. Speaker is not speaking through. I don't have all the information with me. Some did go to see the doctor, some didn't. There are so many cases involved. Next, please. A gentleman at the back, please. Last but one row. Cable TV. For the Kwai Chung estate, the number has come right down. For the 2 blocks that are placed under lockdown now, to expect the lockdown to be lifted tomorrow. And for Taiwo Hao Estate, there are still some cases. The same can be said about Xiwanshan Estate. Do you think that we should really conduct compulsory testing there? Of course, we'll see how the testing is proceeding. If there are no further deterioration, then we'll proceed according to schedule. Now, for the Taiwo Hao Estate, we did conduct compulsory testing where they live. We have not identified any specific chain of transmission in a massive way, although there are some cases in individual blocks. English question, please. Last but one row, the lady there, please.
A few questions from RTHK. The first one is for the school outbreaks. How many students are infected and quarantined in each school? And also, is school outbreaks today more widespread than previous school outbreaks? And does it mean that the teacher could be the one spreading virus with his or her mask on? And also, as retired people are getting COVID, so what does it mean? Thank you.
As compared with the previous waves in the third and the fourth waves, we looked at previously we seldom see school outbreaks, even though we have been very cautious about the contact tracing and quarantine. But now, even those settings when they sit in the classroom and have exams, so we supposedly they do not. They did not interact with each other, and there is still transmission. So it is likely that the Omicron is very infectious. Of course, we can't exclude the possibility that they interact with each other while waiting for the exam or before and after school. But we did ask the students, and they do not know each other. So we suspect that the Omicron is very infectious. That's why resulting in some transmission in the schools. For the 中華傳道會理研要紀念中學, so far we have 5 cases, and for the 圓玄學院第三中學咧 we have 8 or 9 cases. So previously we also had Delia Memorial, Broadway, and a few others. We have more cases. Yeah.
Next, please. A lady over there.
I think usually we have some specific exposure for certain people. For example, they went to certain places, or they eat in certain restaurants. But some of the retired people are now also infected. The only places they went usually markets. So it's very difficult to trace markets, because everybody goes to markets. So you never know whether the source of infection is from there. And they mainly stay at home and do not go to special places. So I think the transmission is quite widespread in the community.
Lady over there. Oriental Daily. Chongbo House, the lockdown has been lifted. The Delta variant has a longer incubation period. You'll be observing a number of days before allowing the residents to be back in. Why do you lift the lockdown so early? Are you worried about having another outbreak there? In Tuen Mun, there is sewage that has been tested positive. There are some residents who do not observe the CTN. Will the administration or the CHP be advising universal testing? There are many mobile stations. There are long queues waiting for testing to be conducted. People sometimes cannot really make any booking. Also, for the 2 schools, the outbreaks there. Now, for this CNEC Li Yi Yao Memorial School and also Yun Yun Institute number 3 school, what is the breakdown? You also mentioned the PTA, a coordinator there. What school is the coordinator from? Is that a teacher or is that a parent? Now for the Yun Yun Institute number 3 secondary school, there is a PTA coordinator, and there's a part-time person, and the coordinator will be maintaining order, will be dealing with the students' discipline. All the others are students. Also, CNEC Li Yao Memorial School, there are 5 students involved. A lady is not speaking through. Cheungpo House, yesterday, for the high-risk units, we have ordered the resident into quarantine. The rest of the residents have been tested. We haven't picked up any new cases. Of course, there is an incubation period, and they have to be subject to quite a number of tests. Lady over there at the back, please.
My first question is, why has Tropicana Gardens in Wong Dai Sin been put in the hamster-related cluster, given that the hamster tested negative? So how are authorities sure that it's related to that cluster? Second question is about the unknown suspected Delta case. Is it possible she got infected when she was at the Choi Wan Estate shopping center? And does that mean the Delta outbreak has spread into the community there? Thanks.
Concerning the case you mentioned, we have the whole genome sequencing. And the whole genome sequencing shows that the case is very closely related to the hamster-related, those genome sequencing from the hamster and the other cases. So we suspect it is possible that he's also related to that cluster. Although the hamster has not been tested positive, I understand from the experts that for hamsters, they only carry the virus for a very short period of time. Unlike human, we carry it for quite a while, so that we may not, the hamster may not be tested positive when we submit it to the AFCD. I also understand from the owner, from AFCD, that the owner refused for the hamster to get tested through blood taking for the serology. So that's why we have no way to confirm whether the hamster had past infection. And we are still investigating the unknown case with suspected Delta, because it is so weak that she only went there to buy some bread. So we need to ask for more details and whether she has other places that she got infected.
For the genome sequencing, the case you said that's very similar to those in the hamster cluster. Are you talking about the 26-year-old?
Yeah, and the other related cases.
How?
Next question. I'm from Dim Sum Daily. So about 100 people will be spending their Lunar New Year in Penny's Bay. Would the CHP be preparing some New Year gifts for them? So what preparations would you be making for those who would have to spend their New Year in quarantine? Oh, New Year gifts. Well, I have to see if other departments will make arrangements for that. I cannot give you an answer. The lady in the back, please. There have been teachers and students becoming infected in recent days. Are they engaged in any high-risk activities? Are you able to trace where they have been? Do you have any information for us on where these untraceable cases have been to? For example, the delivery man, where has he been? Mr. Zheng said that if there is a strong outbreak, then we would need to adopt the services of clinics. Would you actually also be prepared to do that? In Sin Kwong Center and Wong Tai Sin, contamination was found in the sewage? Was it the Delta or the Omicron variant? We still see new cases in Kwai Chung Estate. Would it actually be a high risk to actually to relax the lockdown? I'm from Economic Times. We would issue compulsory notices to high-risk areas on where the untraceable cases have visited. I'm not sure whether the sewage sample is the Omicron or Delta variant. Well, at this moment, we're still working with the government on imposing restriction testing declarations. So for confirmed cases, we would send them to hospitals. And they would usually be sent to the North Lantau Hospital, Hong Kong Infection Control Center. For those with mild symptoms, we would send them to AWE. And some patients may need to be admitted into a hospital in negative pressure wards. How things are changing constantly, we'll just work with the government. They are not close contacts. I mean, they didn't eat together or shop together, nor do they live together. They may only have spent some time in the same space for a short period of time, such as students taking exams and a teacher monitoring the exam. So it's more likely that it is the Omicron variant because it is highly infectious. In the third and fourth wave, we didn't see such kind of transmissions. Instead, this time, we see more than one school with such a transmission. It might be because of poor ventilation. This ends our press briefing today. Thank you.